what a public option would you vote for hybrid that?
Probably not. I don't, the answer is, I'd have to, like anything else. Right now, the health, especially on healthcare bill. In the House, there are 3 conversions still pending. We've been working constantly. Pretty much the only issue we really talk about now. Trying to figure out how we blend them together and what's going to be the one conversion we come up with. And I think a strong public option would be there. Here's why I'm for it. The other side says, oh my God, keep government out of your health care. Sounds good, but let me ask you something. Medicare, Medicaid, for any veterans, TRICARE, they're all government programs, folks. And they didn't come down with Moses on the tablets. They were politically passed, fought for, very vehemently. Some of you might have been around in 1964. The Medicare, guess what? It wasn't easy. Blood, sweat, and tears of politicians for years to get it done. And when they got it done, the other side didn't give up. They tried to cut it for years. So what is a public option? To me, here's the problem. I'm a federal employee. My health care is Blue Cross Blue Shield. You know how many choices I have? 1. Blue Cross Blue Shield. Unless, of course, I move to another state, then I probably get another. But Massachusetts right here, because I used to be on Harvard, because that's what my doctor was years ago. And all of a sudden I get notified by the federal government, we're not offering Harvard anymore. You got a choice, Blue Cross Blue Shield. Most people who are on employer-based healthcare have 1 choice. Some have 2, most have 1. That's not a choice. Who's my negotiator? I'm not just an individual, but that's a group. So you don't have to. So, public option, in theory, if done well, simply provides an option for you to say, the other one's better, or the other one's cheaper, or the other one, whatever it might be. And it provides the opportunity for legitimate competition in a marketplace that doesn't have one. As a matter of fact, most health insurance companies are exempt from the antitrust laws. And I don't think that's good for us, it's good for them. I want to be clear, I'm not going to beat up health insurance companies. I know that's the way I'm supposed to do it, because, you know, everybody gets mad. But the truth is, they're only doing what we as a society have allowed them to do. If we say to them, you have a monopoly, what do you think they're going to do? You say to a cable company, one cable company, monopoly, you tell me, how do you control their rates? How do you get them to give you good service? How do you get them to show up when they say they're going to show up? You need 2, 3, 4, as many as you can get. That's the best way to do it. That's what the public option will provide, and that's why I support it. Absent that, I don't know any other way we can get competition into the system. That's why I'm for a public option. If they don't have one, I don't see how the system can work. Real effective.